Hello everyone, this is Dr. Swathi. I'm a senior consultant at Shekar Eye Hospital. Today I'll be talking about something called eye spills. Now, eye spills is medically termed as subconjunctival hemorrhage. What is subconjunctival hemorrhage? It is the accumulation of blood between the transparent membrane covering the white of the eye or the sclera, and this happens when a blood vessel present in the conjunctiva ruptures. What are the common causes causing subconjunctival hemorrhage? Generally, it is spontaneous. Sometimes it can be traumatic. Now, spontaneous being the most common cause and is commonly seen in the elderly group. Now, this happens when the pressure within the blood vessels shoot up. Now, it can happen without any particular reason, that is the most common form, or it can happen sometimes whenever we cough vigorously or sneeze, or when we have constipation. That increases the pressure within the blood vessels. Now, these blood vessels present within the conjunctival layer are very small and fragile. So they succumb to it, and that causes bleeding. Secondly, in patients with diabetes, hypertension and cholesterolemia, these are at risk of developing subconjunctival hemorrhages. That apart, if patients are on blood coagulants or blood thinners, they are also at risk of developing these blood clots, because the blood vessels are very fragile in them and the blood consistency is also relatively thinner. This apart, the other common cause is trauma. Trauma can be as small as vigorously rubbing your eye, or post-injury in and around the eyes, post-eye surgeries as well. Rarely, this is also seen in patients having blood bleeding disorders or coagulopathies. Generally, patients are asymptomatic. They don't realize it, or they, unless a relative of you points out that there's a red spot in your eye, or you may notice it when you look into the mirror. They are asymptomatic most of the times, unless it's associated with an injury. These can range from being tiny red spots to the entire white of the eye appearing red in color. Generally, since they are asymptomatic, we do not treat them. They are not visually disturbing. That is why it's not like an emergency, like a serious emergency. Again, unless it's associated with trauma, unless it's associated with other symptoms like proptosis or swollen big eyes. Now, when the hemorrhage is large, it tends to lift or elevate the conjunctival tissue. So that is when one may find a little bit of irritation each time you blink your eye. So then what do? We give lubricating eye drops and ice packs to reduce the swelling and puffiness. It generally takes about 8 to 10 days to resolve when it is small, and up till 1 month also when it is large. Does it require any surgical intervention? Definitely not. And does it require you to stop taking your blood thinners? Definitely not. You can contact the eye specialist whenever it is associated with other symptoms like pain, or whenever you see that it is enlarging or it is progressive. Then we need to find out if there is any other cause for it. So when you visit us, we generally diagnose it clinically itself. If we have a suspicion that it could be associated with anything else, we will do a thorough investigation of your coagulation profile as well. Otherwise, just a reassurance with a few vitamin C capsules and or with lubricating eye drops. For any further queries, you can contact us at Shekar Eye Hospital. Thanks for watching.